Let me give you a quick overview of the CDL drug and alcohol testing methods and detection times that the FMCSA actually has in place right now to make sure that truckers, delivery guys, delivery people in general are really playing by the rules. Okay, so let me give you a quick overview first before we get into the nitty gritties. The thing is that everything actually started about 60 years ago when the government started really toughening up laws when it comes to, let's say, drug and alcohol, let's say, testing. Okay. But things actually got more serious, if you will, 5 years ago in 2015 when actually President Obama actually put in place a law called the Fast Action Bill. Basically, among other provisions in that law, basically you have now the let's say a condition whereby federal authorities but also state authorities can really look into a hair follicle. Okay, so they're doing hair follicle drug testing as a DOT approved method. Okay, and it's one of those things where basically this changed the game real time, because back then they were only doing like urine testing, and now because they are adding an extra layer of accountability in the process, this really made things more, not more complicated, but more interesting for trucking companies, but also truckers. Okay, so basically, if you are a truck driver right now, let me talk to you about what you need to know about methods of drug testing. So if you are a CDL driver or you are a potential CDL driver, you will be required to submit to drug and or alcohol screening at any time in the pre-employment or employment process. And it doesn't matter what company you go to, they're going to really request that anyway. So DOT regulations prohibit all kinds of drivers from refusing a drug or alcohol test. So if you refuse, you are not going to get hired. Okay. So now the only legally accepted method to satisfy federal DOT drug testing requirements is through urea analysis (UA), though many companies are using hair follicle testing in addition actually to a UA. So you do have this possibility. Okay. So now if you will be tested for the presence of Schedule 1 narcotics, I'll speak about that later on. So Schedule 1 narcotics, but also prescription drugs. In some cases, as a driver, you will also undergo alcohol testing. Okay, so that's an important element to really think about. Now, when a drug is processed through the body, it produces metabolites, okay, which collects actually in the bloodstream and hair follicles. So drug tests are used to detect the presence of those metabolites. Okay, it's something to really think about. So if you think about CDL drug testing, drug and alcohol testing, you have to really understand the factors that affect drug and alcohol detection times. Because I mean, first of all, you do not want to really drink and just start driving. You do not want to do that. But it's important to understand how those things work in your system before you actually apply for a trucking job. Okay. Now, while there are generally accepted detection times, what research has shown is that there are many factors that can impact urinalysis drug detection timeframes. Okay, so you have, for instance, the amount of drug used. So what happens here is that the higher the amount, the longer the detectable time period. So if you use a large dose, that means that the government has up to 1 week, for instance, to actually detect the substance in your system. You also have tolerance. So if you are a regular user, you may require higher dosages to achieve the desired effect. Also, the length of regular use. So the longer a drug is used, the longer the detectable time period. Okay. You also have an important element, that's hydration, water. Okay. Detection times will generally be lower for a well hydrated body. So if you drink a lot of water, I'm not telling you to drink and drive, but if you were to drink and you were to drink a lot of water, the water will dissolve, if you will, the substance in your system. Your body size too. So the presence of substances may be detectable longer in larger bodies. You also have the metabolism rate, so your metabolic rate. So the faster the metabolism, the faster a substance will pass through the system. You also have body fat. So substances may actually stay in the body longer in people with higher body fat percentages. So something to really think about. You also have the method used. So drugs that are ingested in pill form may take longer to leave the system. Your age also will play an important role because generally substances will not be flushed as quickly from the body the older, okay, the older it gets, and your diet too. So certain foods may affect the metabolism of drugs through the liver. Let me quickly dig a little deeper when it comes to the urinalysis, the UA. So if you think about CDL drug and alcohol testing, urinalysis is going to be quintessential. So urinalysis, in addition to a testing for drug use, can actually be used as an indicator of overall health, right? For instance, to detect kidney and metabolic disorders, urinary tract infections, UTIs, and blood sugar issues, let's say diabetes. So that's something to really think about. And what happens here is that urinalysis actually is the most common method of drug screening used, and is currently the only method accepted to satisfy federally mandated screening. Okay, I mean they're doing hair follicle too, but urinalysis remains the key method. So generally, urinalysis test will be done for drug use within a 2 to 10 day window, but the type of drug and frequency of use will cause the detection window to vary widely. So something to really think about. Now, steroid use can generally be detected anywhere from 14 days to 3 months, depending on the type and frequency of use. Now, it really depends also on the timing of the urinalysis. Okay. Now, if you are a heavy marijuana user, basically you are really putting yourself in let's say in a more in a stricter on a stricter path. Let me explain. Heavy marijuana use could be detected through urinalysis for up to 60 days. Can you imagine that? 60 days. That's 2 months. Now, passive exposure, in other words, secondhand smoke, will generally not give a positive test if exposure is limited. Now, samples collected in the morning are more desirable for testing because they will be more concentrated and likely show more abnormalities. Okay, so that's an important element to think about, especially if you are trying to really get stuff done real fast. That's an important element to think about as well. Let me dig a little deeper in terms of UA here. I want to really talk to you about the urinalysis testing and examination phases. So a complete urinalysis will be made up of three separate testing phases, and I want you to really pay attention to those phases because they are going to if you go in for a job, they're going to really pay attention to those. First of all, you have a complete you have visual examination. So that's the first one. You have chemical examination, the second one, and the third one is a microscopic examination. So visual, chemical, and microscopic. Okay, microscopic. What am I saying? Microscopic? No. Microscopic. Okay. So when I think about visual examination, so the color, concentration, and clarity will be really evaluated when you go through the test. Okay. Those are the three things I want you to pay attention to: color, concentration, and clarity, what I call the three C's. So that's for the visual examination. Next, you have the chemical examination. So if you are going through a urinalysis test, they will test also your chemical examination. So normally, specially treated test strips will be dipped in the urine in your pee, okay? And specially treated sections will change colors to give the technician results, either to determine the presence or absence of drugs or to evaluate other general health issues. So that's kind of important, okay? So, yeah. So that's for the second one, chemical. What about the third one? Microscopic examination. So visual, chemical, and microscopic. So basically, this will not be performed as part of a drug test, except in the case of abnormal findings during the visual or chemical examination. So basically, the third option is more optional. Okay, I mean, what am I saying? This is tautology. The third option will depend on the results of the first two. So the first step is optional. Okay, so now one thing I want to say here is that if you ever go through a microscopic examination, that's fine too. That's totally fine. There's nothing wrong with that, especially if you have nothing to worry about, if you're comfortable about anything, then yeah, okay, that's an important element to really think about. So let me talk to you about how far back actually do that urinalysis tests go, okay? Especially if you are worried about how long will drugs stay in your urine, okay? So first of all, here is the urinalysis detection times. I'm going to put this on the screen so it's pretty clear to everybody. So basically, if you talk about marijuana, for instance, the marijuana detection times, you have usage one time only. You have 1 to 8 days, usage 2 to 4 times per month, 11 to 18 days, usage 2 to 4 times per week, 23 to 35 days, usage daily, that's 33 to 48 days, and extreme daily usage, 49 to 63 days. Again, those are the urinalysis detection times. So if you are a heavy user, don't even think about getting a job as a, you know, as a trucker. What about cocaine? Let's talk about cocaine here. So generally accepted time frames for okay, I can't pronounce that. I'm gonna put this on the screen so that because there is a metabolite, okay, metabolite of cocaine that is tested in the UA. Okay, so it's called a benzo something. So I'm put this on the screens here, benzoylecgonine, whatever. So for a casual or single dose users, you are speaking about 1 to 5 days. Regular or high dose users up to 8 days, and heavy or chronic users as long as 14 to 28 days or longer. The thing is that you got to really ask yourself whether or not it's worth it in the first place, right? Because you can see that those tests are pretty deep. I mean, they're not really trivial at all. What about opiate? Let's talk about opiate. So, but before I talk about opiate, use of alcohol or caffeine alongside or after using cocaine will lengthen the amount of time it takes for this metabolite to be eliminated. So just be aware of that. So you have now the opiate. So common opiates include morphine, codeine, methadone, hydrocodone, and oxycodone. And opiates and morphine derivatives will generally be detectable in urine for 1 to 12 days, depending on frequency of use and the amount of dosage. Okay. You also have the amphetamines. Amphetamines in general, those have a detection period of 1 to 5 days in urine, and you also have the phencyclidine, the PCP, angel dust. PCP is actually stored in fatty lipid tissue and can be released into the bloodstream for up to several weeks. So general guidelines are 1 to 10 days for casual use and 1 to 4 weeks for heavy or chronic users. So now I'll just finish talking to you about urinalysis. Let's talk about hair follicle drug test. Okay. And so one thing you need to understand here is that all substances will remain in the hair follicle until hair is cut off. Okay. Drug use can actually be detected through a hair follicle testing after approximately 5 to 10 days. The average time that will take for affected hair to grow past the scalp, and most hair follicle drug tests will test for a period of 90 to 120 days. So as the average human hair grows about half an inch per month, that would require 1.5 inches of hair for testing. So something to really think about. Okay. And now how a person's head grows on average of half an inch per month, and the average length of hair is 1.5 inches, you have to understand that this is going to affect the testing time big time. So the normal standard is for actually the trucking companies to use hair follicle testing to check back 90 days for the presence of metabolites indicating drug use. So hair is cut as close to the scalp as possible, and the minimum amount of time tested is normally about 1 month. Sometimes they go to 2 months, but 1 month is actually the average here to really think about. So if the hair on the head is not long enough, body hair can be submitted. Body hair grows slower and is normally replaced yearly. So it is more difficult to accurately represent a time frame here. And hair follicle testing actually has been shown to be more effective than urine analysis in detecting low level drug use because most drugs are rapidly excreted and undetectable with urine analysis within about 72 to 96 hours. Let me give you an example. Marijuana screening is actually known to be slightly less effective when using the hair test, but it is accepted as a rough equivalent. So something you really think about. So around 70 to 100 hairs are needed to perform testing on hair follicles, or roughly the diameter of a pencil. Okay. So excess hair that is not used for testing will normally be kept in the chain of custody container for various periods of time, depending on the testing service provider, the employer, and the negative or positive results. One thing I want to say here is that it's important to remember that basically hair samples are actually washed thoroughly to remove, let's say, external contamination, right? Let's say residue from smoke or other substances, and cutoff levels are established to help prevent positive results from passive inhalation, actually, secondhand smoke. Okay. So, however, washing, shampooing, and let's say treating the hair will not remove traces of drugs within the hair, nor will it cover them up. So, something to really think about. This is at the follicle level. Now, what is the maximum back for truck drivers? Okay. Now, alcohol is normally detectable with a breathalyzer for up to 12 to 24 hours. So, rule of thumb is that a body will typically burn an ounce of alcohol, that is one shot or one beer per hour. Now, alcohol testing will normally be performed using a DOT approved breathalyzer device, evidential breath testing device, or EBT. And a positive test for alcohol concentration of more than zero point zero 0.02 in the system will be confirmed by waiting 15 minutes and retesting. So a confirmation test showing less than zero point zero 0.02 back will require no further action, while a test of zero point zero 0.02 back or more will be reported to the employer. Okay, so in some cases, a driver's blood alcohol concentration back may be checked by testing saliva instead of doing the breathalyzer. They go through saliva. So a positive test of zero point zero 0.02 will require that a driver be off duty for at least 24 hours, although some companies will extend that sort of off time to 48 hours. And a level of zero point zero 0.04 or greater will require a CDL holder to be placed out of service until completion of the return to duty process. And this return to duty process can be really lengthy or short, depending on the company, but also the states where the offense actually took place in the first place. So, in conclusion to this conversation, I just spoke to you about CDL drug testing and alcohol testing. Okay, I gave you the overview, the extras, and the conclusion. Thank you so much. God bless you. I will see you next time. Until then, remember, stay marvelous.